All right, and you want this to be sealed because if it's not, when you're doing your check to make sure there are no leaks, you're not going to pass. So you make sure that that's clamped. Then we're going to connect it to the tubing connected to the gas return. And we're going to hang this right here for now. Now when you take this into the patient's room, you want to connect it to a power source that's also connected to a backup generator just in case anything happens, so that it maintains power. So we're going to switch this on. Start testing it. We're going to start a testing. We're going to unplug the Y at the top. We're going to plug it back. You want to make sure that you have your temperature probes plugged in or you're going to fail the test. Much better. Okay, so we passed the test. Now the ventilator is ready to be used. We're going to turn it back on. You also want to make sure that the patient's family, if they're around, just talk to them about the vent, about how it works, about how it takes over the patient's breathing, about how it's going to help them, different things like that. Patient support, family support is going to be one of the most important things in any kind of recovery. The alarm's going to keep going off because it's not connected to a patient right now. So we're going to check our original settings. A rate of 12 works great, tidal volume of 500, peak flow is set at 60, and we have a PEEP of 5. The eye trigger's at 3, and then your oxygen, your FiO2 is going to be upon what the patient needs, how they're doing, based on ABG results. You're going to continuously want to be getting ABG results based on hospital protocol and what the physician wants, whether it's every hour or so, because you're going to need to titrate FiO2 and to consistently be changing your settings. If the patient isn't getting any better, you might have to change modes. Currently we're in volume control, assist control. You also want to check their pulse, their blood pressure, their respiratory rate, just to continuously see how they're doing. You're also going to want a chest x-ray just to see ET tube placement, that it's above the carina, that it's not in the stomach. Then you want to check for bilateral breath sounds to make sure the vent is working properly. Then you have your alarms, your high pressure and your low pressure. You probably want those around, 10 above or below. A low PEEP is set at 3, which works fine. Your high rate, your apnea needs to stay around 20 consistently. And then once they're set up, it's basically just going to be evaluation and monitoring from there on out. Consistent ABGs, your ABG is going to be your best friend on knowing how the patient is reacting to the treatment. And A-line would work great for that. Now in this bag, that's also going to come with us, this is going to be hooked up, at least in the land, it's hooked up to every ventilator. You have a fastener and a bite block hooked to the tube. There's an aerogen, which is going to be in line for any kind of aerosol treatments. We also have closed suctioning in here for any kind of secretions. And then you're also going to have a box of saline just for flushing, anything like that. And then continuously checking on your patient until the time comes to where we extubate.